Good afternoon. Welcome. I'm Tammy Coleman Epps, and I am the Director of Media Relations and Social Media here at Prisma Health. I know that many people in the community, like me, who have been watching the NFL, have seen the many conversations that they've been having about concussions. And that is at the highest level of a sport in our country. So with that, we know that many of you in our community may also have questions about concussions, because we have many of our young community playing in sports. We have elderly people who may take a fall, and concussions is an important condition that people should know about. So because of that, we at Prisma Health have assembled a group of our professionals to give you some information in the community about concussions, what you should know, and how you should manage it for your community. So thank you for joining us. Thank you to our media partners also, who are also joining us today to get this important information out to the community. Thank you to our Facebook groups who are also joining us today. So with that, I'm going to introduce our panelists. So first we will have Dr. Jeff Holloway. He's a pediatric sports medicine doctor, and he's the director of the Pediatric Concussion Center here in the Midlands. Of course, because of our USC School of Medicine affiliation, he also is an assistant professor at the UofSC School of Medicine here in Columbia. Then we have the pleasure to add Dr. Fredy Revilla. Dr. Revilla is a neurologist. He is the chief of the Division of Neurology in the Upstate. And he's also a professor of UofSC School of Medicine in Greenville. So we're glad to have our that affiliation with our partner at the UofSC. Good. And we also have Aysha Reyes, who is an athletic trainer with Prisma Health Orthopedics. So with that, we're gonna go to Dr. Holloway. And so Dr. Holloway is gonna kind of talk us through those beginning things about what is a concussion. So let me go to Dr. Holloway. Dr. Holloway. There you go. Hey, Dr. Holloway.
Hey.
Good. Thank you. Thank you. We're glad to have you on with us today. So, we're going to start with a basic question. So the basic question is, what is a concussion? So people understand what that is.
Yeah, I think it's something that gets misunderstood sometimes. And so I can kind of talk it in, medical terms and then more layman's terms, but it's a complex pathophysiological process that's affecting the brain after traumatic forces. And so basically what that means is when you hit your head or you have forces transmitted to your brain, so you don't necessarily have to hit your head like in a car accident, then you have a pathophysiological process going on. So basically some changes in the function of your brain. And then that can produce a lot of symptoms. Luckily, it's something that usually resolves on its own, and we don't see any structural damage in the long term from those type of injuries.
Okay, so we know what it is, and we keep hearing on the NFL and on the fields across America, we got to follow the concussion protocol. So for us lay people, we might not understand what that means. So can you explain that to us a little bit?
Yeah, I think the word concussion protocol just entails all the things we do with concussions. So the NFL's one is a 19-page document that talks all about concussions and how to treat them. So it's things like figuring out if someone had a concussion, so looking for the potential symptoms, which include things that range from the basics of headache, dizziness, all the way up to thinking of mood changes and personality changes, and the patient just doesn't seem right. And so it tries to lay out a lot of information that can guide someone in making that diagnosis. And then once we've made that diagnosis, what's the best protocol or steps to follow to, one, remove them from play, assess them fully, and then figure out a game plan as far as keeping them from dangers and also rehabilitating them back to themselves to get back to playing safely. And so I was going to say the concussion protocol can mean a lot of things. And then what sometimes gets kind of the basic one is the return to play protocol. So that's what you'll hear as those players have to go through certain steps on the field, exercising, progressing back. And that is, again, one piece of the big puzzle when we assess these patients and decide if they're fully recovered or not.
I know, Dr. Holloway, in the concussion center there, you see a lot of pediatric patients who have had a concussion. I guess one of the things that was a question is, before you get to a doctor, what can you do even before you get to the physician to prevent yourself from being re-injured?
Yes, and so I think that's where, again, it is one of those diagnoses that a lot of people have to help these patients out, from the coaches, the athletic trainers, the parents, the schools, all have to do their part to help these patients recover, and not just say, we'll go see the doctor in a little bit and they'll take care of it, because again, this is not something we have a pill or shot or surgery that fixes. And so some of the important things are staying away from the dangers of repeat injury. And so making sure that that's fully conveyed to the patient, and then all situations, we're avoiding those situations. And then understanding it as an energy problem, an energy crisis. So the patient needs a lot of energy to heal their brain. So we don't want to be using it up doing things that aren't important. So that's where you hear about them saying, don't play too many video games, be on your phone and things like that, but let's concentrate on resting for a couple days and then easing back into the basics of school with some adjustments, accommodations, taking breaks, and then slowly feeling better. And again, that's what we would do if I saw you the next day versus a week later. And so sometimes making sure we have all those protocols and procedures in place to help the patient out and avoid further damage and worsening it over time.
So what is a recovery from a concussion like?
Yeah, so the average in kids is somewhere around 2 to 3 weeks, they say. So which does take a little bit longer than the adults. So some kid might see an NFL player get injured and then be back the next week and wonder, why has that happened for them? Well, there is a lot of data that says kids just happen to take longer to recover also. But when you look at the general scope of things, most kids get better in 2 to 3 weeks, but about 1 in 4 don't. And those patients can go on for months to even up to years of having symptoms if not dealt with appropriately. So the recovery is different for everyone. And that's what we always say too, is each concussion is unique. So each patient having what they have at baseline will then decide what are some of the things that cause that concussion to last longer or recover quicker, and some of the things we have to deal with along the way.
So basically there's no prescription necessarily for it. Everybody's a little different when it comes to recovery.
Absolutely. And I think that's part of why I like this field too, is it is unique to each patient. So it's not just a cookie cutter thing. So while we do have those protocols set in place and that everyone should follow certain basic things, each patient's going to be a little bit different in what they're able to do the next day and progress along back to recovery. And then we try to provide some objective data in our clinic to assess some of those things, looking at how they're recovering cognitively, emotionally, physically, and looking at their whole brain, because a good thing is your brain is very complex. And so we got to look at a lot of different aspects to make sure you're okay back to normal after concussion.
Well, I'm going to go to Dr. Revilla, because one of the things that we worry about is what if people don't get treated? What happens if people have a concussion and they don't get treatment?
Excellent question. So first of all, thank you so much for inviting me today. And it's a real pleasure to be here with an expert such as Dr. Holloway, one of my colleagues here at Prisma Health. From the neurological standpoint, it's, of course, what we do on a daily basis as neurologists to treat patients with neurological disease. And traumatic brain injury is, of course, one of the significant causes of brain problems. What happens after somebody has a concussion, and as Dr. Holloway said, it depends on the forces involved in the concussion, or if it's a sports related, or if it's an accident, etc. There can be lesions in the brain that can be detected by an imaging study, such as a CAT scan of the head, for example, or MRI of the brain. But we also have learned that concussions, even when the imaging studies are normal, can have some consequences at the cellular level, at the brain cell level. And more important than that, we have also learned that repeated blows to the head, even if they are considered relatively minor, can have long-term consequences in the brain and mostly in the cognitive function of the person. And it is something that has been recognized now in the literature, that exists a condition called CTE, or chronic traumatic encephalopathy, where repeated blows to the head can cause problems in the brain that are chronic, and we have to see certainly some of those cases in our clinics. So just highlights the importance of treating the concussions adequately, especially when they're reported related to sports, and give the brain enough time to rest.
So, Dr. Revilla, what is second impact syndrome? When you sent those notes over to say that that was something we're going to talk about, I've never really heard of that before. Can you explain that? So,
second impact syndrome is an important topic to discuss. It's different opinions on it. It's not 100% clear what it exactly means, but it refers to a situation where somebody, after having received trauma to the head, in other words, after having had a concussion, receives a second hit to the head before completely recovering from the first one. And the theory says that maybe that brain that has been injured in the first concussion is not yet completely recovered, and even with a second injury of the same level, or sometimes of a lesser level, a more minor injury, may suffer more because there might be changes at the cellular level where there is brain swelling, for example, that sometimes is not easy to detect. And so the theory says that a second impact syndrome is dangerous because it can have much worse consequences than just having one impact to the head. And it kind of makes sense, but at the same time, it's very important to put this under rigorous examination, reviewing the literature. And of course, if there is a way to test for this hypothesis, that's really the way to go. But it is something that we pay attention very much. And as Dr. Holloway said, a second impact syndrome is best avoided by preventing the player, in this case, after sports injury, sports concussion, by preventing them from going into the field and exposing themselves to a second injury until the first one is completely healed.
Right. So you were talking about CTE earlier, and so you know, we all learned about CTE a lot from the movie, the Concussion movie. I think that really brought it to the forefront more than anything. So as it relates to people, community members and their families and CTE, is that something that we would see in just say a person who's taken repeated falls, or is it just something that mostly shows up, that would show up in an athlete?
I'm not sure I know the answer to that. I know it has been described in athletes who, due to the nature of the sport they practice, are exposed to repeated blows to the head. And the way these studies were presented and the way these patients were described are people who received multiple hits to the head and presumably caused problems that were then seen by a neuropathologist who described this syndrome, Dr. Omalu. And the way this presents in our clinical practice is by the patient complaining, or the family sometimes complaining, of behavioral issues, personality changes, mood abnormalities, cognitive dysfunction to the level of sometimes diagnosing dementia in these patients, but that is how this presents.
So Dr. Revilla, are you seeing patients on your side as a neurologist that have had long-term impact from a concussion?
Yes.
Yes. And so what does that look like? You know, the patient comes in with the things that you're talking about, and then what kind of treatment does that involve if they get to your level?
Well, it depends, as we said earlier, on the level of the concussion. In the acute situation, it may be more the neurosurgeons, for example, and the neuro ICU specialists who may take care of these patients if the concussion or the brain trauma was severe. And we're talking beyond sports in this case. If somebody has an accident, for example, where there's severe trauma to the head, These type of patients may require specialized care by neurosurgery, neuro ICU. And depending on the seriousness of the injury, the patients may have some long-term consequences that then we follow in the clinic or not. Some patients, as Dr. Holloway said, recover completely from a concussion. And this is why it's so important to address this issue of what to do initially, how to take care of the patient initially, be it a sports injury related in an athlete or in an accident of any sort. I was commenting and discussing with team members in preparation for this wonderful conference today that I've been also participated in other types of sports and in different trips that I have made around the world involving other sports, including, for example, rock climbing and mountain climbing. I'm originally from South America and have practiced that sport as well. And that is very common to see, unfortunately, in those situations due to rock fall, etc. So one of the things we recommend for anybody who participates in any type of sports that carry a risk of trauma is to wear protective gear. I'm a big advocate of helmets in any type of situation, but we all know that despite the use of helmets in contact sports, we still run the risk of hitting our head. So again, going back to the point that protocols need to be in place, need to be respected, and need to give the time for the person to heal from any type of injury. And in my case, as a neurologist, most important for any type of brain injury.
Good, thank you. We're gonna go over to Aysha. Aysha is one of our athletic trainers. Prisma Health is the medical provider of athletes across the state of South Carolina, including the UofSC Gamecocks, the Clemson Tigers, South Carolina State, hundreds of high schools across South Carolina. So we have athletic trainers all over the place taking care of athletes at every level. And so, Aysha, I was just going to ask you about, I know that when you're out as an athletic trainer, you have contact with a young athlete who has been injured and y'all are evaluating them for concussion. What's kind of what the process is with that?
Well, it usually depends, on the sport. A lot of times there's restrictions on the amount of time that we can actually assess an athlete, but I only have a few minutes when I get there. So on the field, it's usually a short, quick, and simple assessment. Is there a headache? Are they presenting with dizziness, any nausea? Are they seeing double? Is the light bothering them? Do they remember where they are? If they say yes to any of those, usually I take the precaution to take them out, get a sub in, and then get a more thorough evaluation on the sideline. Oftentimes that's, if we don't have subs, then unfortunately they're going to have to play a man down, or we're not going to force that on the athlete. The great thing about being an athletic trainer is that, I get to see these athletes on a regular basis. Granted, I'm at South Carolina United. There's probably over 1,000 athletes that I encounter every day. But in the high school settings, collegiate, even the industrial, most athletic trainers get to know the people that they work with, and which helps if the athlete is presenting a completely different demeanor than what they are used to. So it helps that we're constantly almost constantly right next to them.
Very good. So Dr. Holloway had talked about earlier about clearing people to play again. So talk about a little bit about kind of what your process is when y'all are deciding whether the athlete can return to play in that moment or a week later or 2 weeks later.
Yeah, so the problem with that sometimes is because, on the spot, it's kind of hard to assess them properly without knowing the long-term effects or signs and symptoms. Like Dr. Holloway and Dr. Revilla said, some of these symptoms don't show up until like 24, 48 hours later, especially pediatric ones. So it's kind of hard to determine if they're cleared or not. So when we're trying to clear them to return to play on the spot, they have to pass certain things. We make them go through a quick return to play where we make them jog, make them look back, make them sprint or make them jump, something to kind of agitate the head. So that way, if any symptoms persist, then we probably should pull them out and not continue play. Right. Sometimes it's hard to because the athletes try to insist that they're fine, even though they're not. Like, you see them stumbling, not walking straight. It's hard to talk athletes out of that mindset that tough it out, because some coaches will actually say like, oh, you just got your bell rung. That's not, we take this seriously. So, we take the return to play protocol seriously, in the sense that if they're presenting symptoms, we're not going to push for a return to play immediately. We hold them back, we test them again, we send them to the doctor if it's necessary, and then we take the concussion protocol seriously. So that way we make sure that these athletes are returning safely to sport.
Right. Oh, with that, I'm going to go back to Dr. Holloway. Dr. Holloway, I think Aysha said something really important. She said that a lot of times the athletes are ready to return before it's time. So can you talk about, how important it is for not only the athlete to advocate for themselves, but for their family to advocate for them, and how really important that is?
Yeah, absolutely. I mean, and that's where part of the protocol and even the NFL protocol is education on this subject. So being a step ahead, so that way a patient doesn't think they can just man up and get back out there, and that they take it seriously and they understand the possible consequences like we've talked about, and understand the ramifications that would happen about going back in. Some of the just brief data that I've seen is that kids are 8 times more likely to have long-term problems if they knew they had some problems and then went back into the game. So again, like we were saying too, of on the field, it's a hard thing to figure out. And so getting them out, getting them in the position where we lean heavily on the fact that we want to protect them as much as possible, and no game is as important as their brain. And then we live by the motto of when in doubt, sit them out, and then having them have a full evaluation so we can better determine where that risk now lies. And often I think that parents and athletic trainers know their patients way better than I do when I first see them, because they know their personality. They know the type of person that would try to push through their symptoms, or if they're having some just kind of personality changes, and those will all be indications that we got to be more safe than sorry.
Right, I think Dr. Revilla brought up helmets and protective gear, and I know that's something that you advocate for all the time. Will you address that for us?
Yeah, absolutely. So with helmets, unfortunately, like he said, you still can get a concussion. There's no concussion-free helmet, but making sure you have the proper fitting helmet, the most updated helmet. There's regulations on those, making sure that we change those out. There is, unfortunately, even like with soccer, people ask me a lot about the bands that they can wear. Again, no data has shown that they would remove the risk of concussions because football players wear helmets. And so I think it's a case-by-case basis, and they've looked into do certain mouth guards help, and while they protect your teeth well, they don't tend to help you too much with concussions. And so trying to look at all the varying aspects. And so one of our basic things is making sure you wear the equipment that is appropriate for the sport, and making sure it fits right will help prevent. And that's where one of the most common injuries we get is actually kids riding their bike, and wearing a helmet decreases the risk of head injuries by 88%. And so that's a huge thing that, again, while you can still get a concussion, we can avoid some of those life-threatening injuries like brain bleeds and things like that with proper helmet use.
Right, and then Dr. Holloway, the other thing I think is we just want to remember is that it's not only athletes who take a fall and may have a concussion. So I know both you and Dr. Revilla take care of people who've had a concussion that was not involved in any athletic activities per se, like a organized sport. Could be rock climbing, could be somebody who fell at home.
Right. So yeah, we see from all aspects of, I think I saw a kid yesterday that fell out of his bed. And again, so some kids fall and bump their head and they're okay. But I think that's where, again, just keeping in the back of our mind that concussion can be there, and that reassessing and thinking about it the next day, and not just saying, well, maybe they're just having an off day, but maybe connecting those dots is very important. And then understanding again how all that connects, where again an athlete might have all the resources in the world, but a patient that doesn't play sports doesn't have that same protocol set in place with the athletic teams. And so what do we do for them? And that's where, again, schools need to have certain academic accommodations and protocols in place for all of these patients that have suffered a mild traumatic brain injury and need those resources available.
All right, I'm going to go back to Dr. Revilla. So I guess that whole conversation about the fact that concussions is, we're seeing people who have concussions that are not involved in athletic sports. So can you talk a little bit about that, Dr. Revilla? Because I think, in our minds, a lot of the community thinks it's just those people who, have been in the organized sport.
Yes, very important topic, and I'm glad we're closing the loop that way, because sometimes a person falls and has a concussion and goes to the doctor for the concussion. But the question we ask in our clinics as neurologists is, why did the fall occur? And it is that in many cases, we realize after getting a detailed history that the person, especially as age advances, some people start to develop balance problems and may have stumbled a few times until they actually suffer a fall, or maybe they have fallen multiple times, but this is the one fall where the person hit their head. And then we realize that there's an underlying diagnosis of a neurological disease causing a balance problem. Things that come to mind quickly are Parkinson's disease, for example, can cause balance problems. People with other neurological diseases can have balance problems and suffer a fall. So it's very important to not only evaluate the person as a physician for the actual fall or the consequence of the fall, but also evaluate them for the underlying causes of the balance problem.
Right, thank you. I'm going to go to Aysha.
Yes.
Aysha, I think one of the questions is, do you feel empowered, or are the athletic trainers really empowered to insist that a player not return to the game if they feel like they don't meet the concussion protocol? If they don't feel like the young person is able to go back in, do you feel empowered to just leave it, to pull them out?
It's yes, but at the same time, one of the biggest issues that I've been encountering is that parents, and coaches who insist that, hey, like, they're fine. It's difficult, especially for minors in an organized sport, because the parents technically kind of override me because they can't make decisions for themselves. I advocate for my patients. I do not in any way, shape, or form push everything under the rug because of the fact that these are their heads. This is one brain, I keep telling my student athletes, my patients, that we haven't successfully transplanted a brain yet, and we only have one brain, and we need to use that. We need to make sure that they can play more games, even though they miss 1 week of practice or just one game. It's a hard and a painful discussion with the parents, just because oh, well, they say we paid for this, or I want to see my kid play. But at the same time, I want to make sure, us athletic trainers want to make sure with the doctors that we're taking care of these patients and we're not just throwing them out, leaving them, get hurt again.
Yeah, thank you. I'm going to go back to Dr. Holloway for him to be able to talk about that. Dr. Holloway, what would you say to those parents out there who are advocating against what their athletic trainers and others might be telling them when their child needs to be evaluated further or evaluated on the spot, and they say they don't need to return right now?
Yeah, I think that's always a tough situation on all injuries, but just like Aysha said, the brain is just too important to risk in those situations. I mean, if we're talking about you broke your finger and you might have a crooked finger the rest of your life, there's a lot of football players that would sign up for that easily, but I don't think they understand the ramifications that these injuries can have. And so again, that's where I think the stuff leading up to these is more important than at the time, because I've seen coaches that I know are good people, and they're like, I think you're fine. Do you want to get back in? Because they know that patient gives, or that that athlete gives them the best chance to win. So they sometimes have to turn off their brain from a coach to thinking through that. And that's what our job is. And so that's what an athletic trainer's job is to help advocate for your patient. So I would flip it sometimes and say, well, why are they trying to keep your kid out? It is kind of funny because we have had situations where an athletic trainer is on a different team, or even one of my colleagues went over and tried to help a patient on the other team. And they said, well, why are you trying to keep my kid out? You want to win? And we were like, that's the last thing that we care about. And so I think it's everyone just having different thoughts into it. And so part of it is these type of discussions and these type of understandings are things that we hope begins those conversations. And I think we've gone a long way to making concussion at least something that people think about. And then again, that's where we don't want to forget about other things going on, like neck injuries and things like that can also be there. And some of the patients I've seen that get missed with the concussions are the ones that had like an eye injury or dental injury, that the concussion is there, but we're spending a lot of time and we're seeing doctors that are experts in those fields. And so again, this is where everyone has to do their job of considering concussion and then going down those tracks if we need to.
All right, I'm going to give you some each person some final thoughts. I don't think we have any additional questions. Dr. Revilla, I'm coming back to you now. Let's see. All right, so Dr. Revilla, people out there listening, what are your final thoughts of what they should be thinking about when it comes to concussions?
So first of all, I want to thank you for organizing this panel discussion and emphasize the fact that the people involved in the acute care of the situation are here. Dr. Holloway, Aysha, myself as a neurologist. And this is important to educate the public and our colleagues about this topic, because the last thing you want as a parent, as a coach, as a player, is to end up seeing the neurologist in the clinic. We don't want that at all. So the best thing to say and to close my participation in this excellent panel discussion is to emphasize the prevention. As with many other diseases where prevention is key, here we can prevent it by being very aware that once any one of us or an athlete suffers a concussion of any type, even if it's minor, it's better to take it very seriously and get the necessary rest for the brain to heal, and by all means, avoid a second concussion. So thank you so much for inviting me today.
Thank you. And we're going to go to Aysha. Aysha, I know you're out there on the sidelines. What would be those final thoughts you'd like to give? And then we'll give Dr. Holloway a chance to wrap.
Well, again, like Dr. Revilla said, thank you very much for inviting me over. Like I always say, and I don't mean this to fearmonger anyone, but we only have one brain. Again, we haven't successfully transplanted a brain. So I always tell to parents and I always tell it to athletes that I encounter with concussions, is that I would rather see them be able to pick up their kids, their grandkids when it comes to it, rather than become, be someone who can't even walk on their own because of the consistent head injuries that they encounter. And I appreciate parents who help me out, and I appreciate the doctors that help me out on a daily basis. And I appreciate the athletes that they trust me with the time that they do when I'm there to help them. I want to thank everyone who's been involved in my growth in this, but also I've learned the hard way because parents, coaches, I'm going to have to fight a battle one of these days. And sometimes it's that, and I will always advocate for my patients, for my student athletes and my patients.
Good, thank you, Aysha. We're gonna go back to Dr. Holloway for the wrap. Dr. Holloway, this is final thoughts today. Thank you for everybody for participating with us, but Dr. Holloway, your final thoughts.
Yeah, thank everyone for participating, and I would just urge people that have questions or concerns, that's what we're here for. So if you even just want to send us an email, it's simply concussion@prismahealth.org. And I think just understanding where concussions are, and again, I think you hear about concussions and you see people recover from concussions, so you think, well, they're not that serious. And while some people would argue, again, while they're called a mild traumatic brain injury, that has to do with at the time they're not life-threatening. So when you have an injury, we do have to rule out those life-threatening injuries and why the ER gets involved and needing to see someone urgently. But we would say concussions are serious and that they can cause serious long-term issues, as we've talked about. So that is the point that we want to convey and make sure everyone knows, so we can address that, because unfortunately when people get to me too late, sometimes it's hard to undo what has already been done. And so again, if everyone around people are involved in understanding concussion some, that can make a huge impact and affect a lot of people's lives.
Thank you. So I get the wrap. Thank y'all. We appreciate it so much. Here at Prisma Health, our goal is to make sure we keep our community healthy. We'd rather not see you in the clinic for a concussion, but if we need to, please let us know. We're here to help. So we hope everybody has a great day. Thank you to our media partners again for joining us. To those who are watching on Facebook, if you have additional questions, please send them to us. I think Dr. Holloway said it was concussion. Is it with an S, Dr. Holloway, or without an S?
Just concussion.
Concussion. So concussion@prismahealth.org. And everybody have a great day. Thanks for joining us.